Welcome to the Transplant Institute at Methodist Dallas Kidney Transplant Education video series. This video will provide information about living organ donation. What exactly is a living organ donation? This occurs when someone living donates all or part of an organ for transplantation to another person. Kidneys are the most commonly transplanted living donor organ. Most living donors are family members, but with the advancement of medicine, a genetic link between donor and recipient is no longer required for a successful donation. This means extended family members and friends could be a potential living donor. To donate a kidney, donors should be at least 18 years old, have good mental and physical health with 2 normally functioning kidneys. Living donation has several advantages compared to transplants from deceased donors. Living donations between family members who are genetically similar lessen the risk of rejection. A kidney from a living donor usually functions immediately because the kidney is out of the body for a very short time. Finally, potential donors can be tested ahead of time to find the most compatible recipient, and the transplant surgery can be scheduled at a convenient time for both donor and recipient. We greatly encourage all of our transplant patients to consider pursuing a living donor, as it can greatly reduce the length of time you will wait for a donated kidney. Let's go over a few tips on how to ask your family and friends to consider being a living donor. It is best to have these conversations in person with family or friends who are well aware of your battle with kidney disease. Explain that transplant is your best option and that you are exploring living donation. If they show an interest in learning more about being a living donor, let them know there are many tests that have to be done to see if they would be a match. The evaluation process has many steps, so the donor has adequate time before making a final decision. The steps to becoming a living donor begin with filling out a donor application that includes a health history questionnaire. If this application is approved, one of the Transplant Institute at Methodist Dallas's Independent Living Donor Advocate, or ILDA, will call the donor to discuss their decision. The advocate's job is to protect the donor throughout the donation process. At this point, your transplant coordinator will contact the donor to begin the steps of undergoing a transplant evaluation process, very similar to what most of you went through. Most often, donors can complete all necessary tests, procedures, and consultations within 2 days. A different selection committee will then review the evaluation results and make a decision. If the donor is approved, your transplant coordinator and scheduler will work with you and the donor to find a mutually agreed on time to perform the transplant surgery. Some of the most common questions we receive about living donations are about cost and recovery time. Your transplant coordinator will have more detailed information about these topics, but in brief, the donor can expect a hospital stay of 2 days with the ability to return to work within 2 to 4 weeks. As for cost, the recipient's insurance will cover all medical expenses for both the donor and recipient. Please talk with your transplant coordinator and social worker about other expenses that may arise and what financial assistance resources are available for the donor. Thank you for watching. To continue learning more about kidney transplant at Methodist Dallas Medical Center, please view all of our education videos.